United Nations Sexual and Reproductive Health Agency deeply regrets the U.S. government's decision to cancel all funding agreements. These 48 grants, totaling about $377 million, were used to provide vital maternal health care, protection from violence and other life-saving services in over 25 crisis-hit countries, including Afghanistan, Chad, the DRC, Gaza, Haiti, Mali, Sudan, Syria and Ukraine. Most of the funding supported the agency's work in emergencies, including 16 grants with a humanitarian waiver. Lydia Zigomo is the Regional Director for the UN Agency East and Southern Africa, and she joins me now live. Lydia, thank you so much for your time and for joining us this afternoon, ma'am. What specific programs or services will be most affected by the loss of the US funding, and how critical was this funding to your operations?
Good afternoon, Katlego. It's my pleasure to be with you today. Just to also, before I start, correct something in terms of the fact that although there's been a pause in funding from the US government, we have also received some instructions to proceed with some of the grants which had been terminated. So it's continuing to be a mixed picture, but certainly the impact is in the hundreds of millions.
All right.
In terms of the type of services that are being impacted, I would also like to just say the impact is not just on United Nations Population Fund, but all UN agencies and also different types of NGOs and international NGOs who were providing services, as well as an impact on national health systems, particularly in Africa. So the types of services that were being funded were, for instance, in humanitarian settings where we had the biggest amounts of funding from the US government, mobile clinics that provide services to women who are going through childbearing, remembering that when people are on the move, the reproductive health function doesn't stop. So some of these would have been displaced while they are pregnant and require antenatal care, and then of course they need support to have safe delivery of their babies, and then postnatal care. Also, in of family planning and contraception services, which are so vital to prevent women finding themselves and girls in a situation of unintended pregnancies, both in humanitarian settings, but also just in normal settings or development settings, where now there can be an interruption of the supplies, as America was one of the biggest suppliers of commodities and supplies in respect of family planning and reproductive health, as well as HIV. And also, I would say, in respect of disruption to gender-based violence services. This is in terms of the work done to prevent gender-based violence, but also to respond to gender-based violence, both in development settings and in humanitarian settings, where we're looking at post-rape care that needs to be available, because we know that in conflicts, women and girls are more vulnerable to issues of rape and other forms of gender-based violence.
Certainly. You started by correcting and speaking on the instructions to continue with some of the funding, and you said this is sort of a mixed picture. Can you give us a ratio with regards to how much has been cut off?
At the moment, what we know has been cut off is around 280 million of the grants that we've been asked to stop working on.
Right. And just maybe then talk to us about, with these terminations, Ms. Lydia, how do they affect your global targets, especially with regards to that gender equality and women's empowerment, particularly with your sustainable development goals?
I think it's a real setback for women's equality, and not just in terms of the funding, but also in terms of the whole movement around gender empowerment and women's rights and empowerment. Because, we're not yet living in a world where we have equality between the sexes. And we are still trying to get women and girls where they should be, both in terms of women's and girls' participation in education, in political affairs and public affairs in their countries, and of course, economic opportunities. In Africa particularly, if we look at what's been happening, we've seen progress over the last decade or so in terms of girls' school enrollment. So this has been in part due to funding, not just of the US, but many other governments that have stepped in to support African member states meet and realize those goals to increasing girls' school enrollment. But we still have issues from the point of view of an organization like United Nations Population Fund, who look at the issues of sexual and reproductive health in particular, in seeing girls actually complete their education. So the issue of adolescent pregnancy is still one that blights this continent, and we are very much behind other regions of the world in terms of addressing adolescent pregnancy, which is often unintended and can also be the result of gender-based violence.
Right.
So I think these are the areas, and we still haven't yet achieved parity with men in terms of women's access to credit, to land rights, to property. So that impacts on their ability to really participate in the economic affairs of their countries at the same level as men.
I mean, we made mention of a number of countries that your organization seems to assist with these services, some in the global north and some in the global south. Are there particular regions or countries that you think will be disproportionately affected by this loss? And what challenges do you think they will face specifically?
I think humanitarian countries will feel it most. So countries like Afghanistan, and Yemen, will feel it. Of course, we still Ukraine in the Gaza, they will feel it. But we also have countries here in Africa who will feel it. The Sahel region, DRC, Ethiopia. So I think the impact will hit particular hotspots or where humanitarian crisis is already an issue, in terms of the fact that these are the places which need constant and unwavering support to really meet the needs of particularly women and girls who are living in those situations where their lives have been totally disrupted. And also health services have been disrupted as a result. Schools and education facilities have been disrupted. So they need the most support. However, having said that, I think the impact on national health systems is significant in general, because we still relied quite significantly, particularly in many countries in Africa, on funding from the US to support health systems, and particularly when you think of the countries which were already having very high maternal mortality rates, and those which have also, unfortunately, in East and Southern Africa and parts of West and Central Africa, have also still got the issue of HIV/AIDS as something they're working on. People on treatment, but also preventing new infections of HIV, but also preventing new infections of sexually transmitted infections, and preventing unintended pregnancies.
Of course. So just in the wake of these challenges, then how does your organization foster resilience and innovation within your local communities in ensuring that the work can go forward?
So as United Nations Population Fund, we really believe in partnership. And so part of what we do is very much invest on the localization agenda, ensuring that the support we're giving to national governments also is to local governments who have usually got the primary responsibility to respond to the needs of their populations in terms of services, but also when a crisis hits. But also civil society and NGO organizations, particularly women-led organizations, youth-led organizations, looking at the fact that in Africa, we still have, for much of sub-Saharan Africa, we need to harness the demographic dividend of young people. We are very much a young continent, and we need to look at ensuring that young people have opportunities and also have rights and choices in their lives.
Can true gender equality be achieved for women in Africa?
I think it's possible. We are well on our way in terms of legal reforms that are taking place across the continent. Countries right now are assessing their progress against the Beijing Platform of Action. It's 30 years to that. Last year, we were assessing progress against the International Conference on Population and Development, which was also celebrating its 30th year of existence. So these milestones are important in looking at the fact that there has been a lot of progress on legal reforms to try and address the barriers, legal barriers that were resulting in preventing women and girls from participating equally in their countries. That legal reform requires constant action still to ensure that we are ensuring consistency across different pieces of legislation, for instance, on marriage and age of consent, and eradicating issues like female genital mutilation, preventing child marriages. Having done that, I think the place we're now at is ensuring equal application and enforcement of those laws. Because if that is not happening, what we're seeing in some countries is uneven progress. So you have within a country, regions of the country where we have practically eradicated issues of female genital mutilation or child marriage. But you can see in other parts of the country a high prevalence of those. And that often is to do with the last part that we really need to galvanize our focus on, which is societal and religious or traditional beliefs, norms, attitudes that still prevail in some of our communities. And those are the things which we need to work on to really ensure that we can break that, kind of stagnation we're seeing in terms of really accelerating progress on gender equality in the continent.
Most certainly, and it certainly is a time for Africa to reconfigure and start to find solutions from within in order to eradicate some of these social ills. Lydia Zigomo, thank you so much for joining us this afternoon for this discussion. She is the UN Agency East and Southern Africa Regional Director.